So welcome back. We are going to discuss the peripheral nervous system today as part of chapter 13. So the peripheral nervous system basically links the outside world to the central nervous system. And that goes in two ways, right? We're going to take in our sensory information and we are going to output some sort of motor response. Sometimes it is muscle contraction. So if I want to pick up my cell phone, for example, I think about it, I look at it, it goes into my brain, so the sensory information is telling me that it's over to my left, and then the motor information output is my brain telling my arm and my shoulder and my hand to grab the phone. So there is sensory input and motor output. This nurse here does, med-surg nurse, does a little bit of a discussion on the peripheral nervous system. And again, I encourage you to watch these videos and just see how the topics from the chapter incorporate into either your nursing career, your medical career, or something, and how what we're learning here actually is important and something that you do need to know. So take a look at Christian's video. Okay, so there are going to be four parts to our discussion of the peripheral nervous system. As you can see here, the sensory receptors. So when we think of sensory receptors, what kinds of sensory information is there? There's seeing, hearing, smelling, touching, tasting, right? So we need to have receptors for that. There needs to be some sort of transmission. How does that information get from my fingertips? I can feel the tabletop. How do I know that I can feel that? Because the sensory receptors here travel up the arm through the spinal cord up to the brain to my what's called the somatosensory cortex. Remember we talked about that in chapter 12? So those are our transmission lines from here to there. Then the motor endings and the motor activity. Again, the transmission lines go back out to some sort of motor output. Muscle contraction, glandular secretion, something like that. Then there's the reflex arc. And the reflex activity is interesting because it's sensory, transmission, and motor, but no central nervous system sort of brain or cranial processing. So we'll do a little bit about the reflex as well. So when we talk about the nervous system, right, we have the central nervous system over on the left. It's a little bit grayed out, that's sort of light yellow. That's the central nervous system, brain, spinal cord. The other, you'll notice there's red and blue. The blue means the afferent or the sensory division bringing information towards the brain, towards the spinal cord. So you'll see how the arrows go towards. And then the red takes that motor output from the brain and spinal cord out to the body. And you'll notice it goes peripheral nervous system and then motor or efferent. Motor means some sort of output. From there, you'll see how it branches into what's called somatic and autonomic. Somatic is our skeletal muscle system. Right? It's going to be our voluntary nervous system, where the autonomic nervous system is going to be our sympathetic and parasympathetic balance, right? That's a subconscious motor output. We'll talk about that a little bit more in detail. All right, so the sensory receptors. So the sensory receptors are specialized, right? So the different types of receptors are going to be structured differently, are going to be located in different places, right? So the sight, right, the retina of your eye is for the intake of visual stimulus. The olfactory mucosa of your nose and back of your throat is for the sensation or the stimulus of scent, etc. So we'll talk about type of stimulus, the body location, and then the structural complexity. So here are the stimulus type: mechanoreceptors, touch, pressure, vibration, and stretch. So anything that we can touch, feel, right? Pressure, squeeze, vibration, stretch. A lot of our receptors in our digestive system, our bladder, to some extent in the thoracic cavity respond to stretch. Thermo is temperature. Photo is light, right? Sight. Chemo, any kind of chemical receptors, taste, smell, the changes in your blood chemistry that your hypothalamus and your brain monitor, sort of your blood pH or carbon dioxide levels, things like that. Then there are something called the nocioreceptors. Nocioreceptors are sensitive to pain, extreme hot or cold, pressure, inflammatory chemicals. Right, so those are a stimulus type. Then we have location. Are they inside, enteroreceptors, viscero, right? The viscera, the blood vessels, the tissue, etc. Are they external? Anything outside the body, right? Touch, taste, smell, any of the things that we're sort of getting an idea of what's going on out here. And then a proprioceptor responds to stretch in the skeletal muscles. So that's as a result of some sort of motor output. So these are the locations, inside, outside, or within the skeletal muscles. Then we have the structures. Now we have basically one of two categories: simple receptors, and then the receptors for the special senses. The simple receptors are going to be found throughout the body. They're going to monitor all types of general sensory information. That's going to be our touch and stretch and things like that. The special senses are going to be specific for vision, hearing, equilibrium, smell, taste, all housed in the special sense organs. So the visual receptors are only housed in the eye, one location in the body. All right, so these are a couple of examples, or some of the receptors, and in this table, they're classified by their structure as well as their function. And you can see everything from the tactile meaning touch, it's an exteroreceptor, it's a mechanoreceptor, right? The pacinian and corpuscles, extero, intro, and some proprio, and they are mechanoreceptors. So they come in, you can have different combinations of where they're located and what they do. So this is the general organization of what we're talking about here. This is called the somatosensory system. So if we're looking over here, back at this table, you can see the somatic nervous system, sort of third line down, and the somatosensory. So the sensory goes into the central nervous system, then goes out to the muscles. All right, so that's what we're talking about here when we're doing somatosensory. It receives inputs from entero, proprio, and exteroreceptors. Input is relayed towards the brain, so you can see all of these different arrows headed towards the brain. They're coming from the skin, free nerve endings, the muscle spindle, which we have those stretch, those proprioceptors. The hip, right, a kinesthetic receptor, and you'll notice it's on that joint capsule. So as the leg's moving, it's sensing that the joint is moving, sending that information up the spinal cord, the medulla, the pons, to the thalamus. The thalamus decides, remember, like, what do we need to know? And it goes up to the somatosensory cortex. All right, and that's how we're going to perceive what's happening. All right, is it cold? Is it hot? Are we moving? What are we trying to sort of let the brain know? So when we're looking at how these messages get transmitted throughout the body, right? This is a cartoonish type picture of a nerve. When you look at it, you'll kind of notice that it looks like the structural orientation of a muscle. Remember, we had the entire muscle covered by epimysium, then we had perimysium, then we had the endomysium. Well, you'll notice in that picture, we have epineurium, perineurium, and endoneurium. All right, so it's the same type of arrangement. So around an entire nerve, there are going to be little groups of nerves called fascicles, and within them, groups of nerves surrounded by endoneurium. So we have all these axons, I should say nerves, axons. We have all these axons bundled together, each one covered by endoneurium, a group of them by perineurium, and the whole thing is going to be epineurium. When we're looking at this picture, some of these fascicles are going to have axons that are sensory. Some are going to be motor. So they're either surrounded by being sensory or motor, or they're surrounded by a region of the body. As nerves, sort of like with blood vessels, you have teeny tiny arteries that sort of come together into a big artery. We have an artery that will branch into smaller arteries. So this is what we have here. We can have little nerves that will come together and form a big nerve that will come together into the spinal column. So a nerve is just like a cord, like would be considered an organ. There's a bundle of myelinated axons, non-myelinated axons, all connected with connective tissue. Endoneurium, perineurium, and epineurium. Loose connective tissue, coarse connective tissue, and tough fibrous. Right, again, you'll notice that there's a blood vessel in there, so these will travel with those axons. Most nerves are going to be a mixture of afferent and efferent, somatic and autonomic. So for example, maybe the fascicle on the bottom left, the top part is efferent, where the bottom part is afferent, but they're coming from and going to the same location. Maybe the one in the back is going to be, some is somatic and some is motor, right? Same thing. So just because they're all bundled together, it doesn't mean that all 100 of those axons are going in one direction, nor does it mean it all came from one body region. This might be a nerve of the shoulder, for example, and maybe the fascicle on the left is the anterior arm. The fascicle on the right is the posterior arm. The fascicle in the middle might be the hand, the fingers, right? So it's all branching together and will come into this cord-like nerve. So mixed nerves, sensory and motor, right? Impulses or axons travel this direction and this direction. Some are strictly sensory, some are strictly motor. When we're talking about pure sensory or pure motor nerves, they're very rare. All right, we have somatic efferent, somatic afferent, somatic efferent, visceral afferent, and visceral efferent. Just make sure you understand the difference between afferent and efferent. All right, so afferent means towards the brain, efferent means away from the brain. Now, as we travel or think about the structure of a neuron, right, when we look at this picture, we see all kinds of axons. Well, somewhere there has to be the cell body that those axons originate from, and those are going to be called ganglia. Now, ganglia contains certain neuron cell bodies, right, because of course there has to be a cell body if there's an axon. We have dorsal root ganglia, and then we're going to have autonomic ganglia. When we did the central nervous system and we saw the spinal cord going into and out of a spinal cord, of course, are the nerves from the regions of the body. The cell bodies for those neurons are going to be located in those dorsal root ganglia. And then we're going to talk in chapter 14 about autonomic ganglia. They're more like a chain, but same idea. We're still having the neuron cell bodies. All right, so here we have sort of a picture of a mature neuron, right? They are amitotic. This is how one would connect to the other. This is a picture of a damaged nerve. And this is just a set of slides that kind of gives you an idea as to the regeneration of a nerve fiber. Now, we don't normally think about nerves being able to regenerate, right? But in a peripheral axon, they may regenerate. In the central nervous system, it doesn't, which is why you can have nerve damage in your arm and it may come back. Nerve damage in your spinal cord probably won't come back. Interesting, though. So you can read through the regeneration of the nerve fiber. The Schwann cells clean out the area. The axon filaments grow through the regeneration tube, and we end up with a new axon connecting those body regions. It takes a while. To fix nerve damage can take a long time. It's not like a cut on your arm. It can take a long time. All right, so the next portion of the chapter talks about specific types of nerves, and we're going to talk about the specific nerves. Start with the cranial nerves. There are 12. When we did the central nervous system, we talked about the optic nerves and the olfactory nerves, right, as part of our sort of what we could see on the structure of the brain. We didn't really do number 3 to 12, but they're all named by what they do, and they're numbered from anterior to posterior just in the brain. They all serve the head and neck, except for the vagus nerve, which actually does have an extension that goes down to the organs of the thorax and the abdomen. But for the most part, they're head and neck. 2 are strictly sensory, optic and olfactory, and the rest are going to be mixed nerves. If you want to figure out how to remember them, there are 2 mnemonic devices down there. On occasion, our trusty truck acts funny. Very good vehicle. Anyhow, oh, once one takes the anatomy final, very good vacations are heavenly. So, and here they are from front to back, right? Numbered, olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. And again, we looked at the olfactory nerve, we did the sheep brain dissection, We looked at the optic chiasma and the optic tract for the optic nerve 2, and we didn't really pay much attention to the rest. In terms of what each one of them do, whether they're sensory, whether they're motor, and what they do, that's sort of the next bunch of slides. You'll notice how this table gives you the number, the name, whether it's sensory, motor, and if there are parasympathetic fibers in there. And the parasympathetic fibers are autonomic in function. But a couple of them do have parasympathetic fibers. Most of them are mixed, like we said, 3 through 12. 1 and 2 are sensory only. And then this table, 13.2, gives you an idea of what it does, where it is, what might go wrong if there's a homeostatic imbalance. I'm not going to go over each one of these. You can feel free to look them over. I'm not going to ask you to memorize, right, what they do. Just have an idea. Right, the cranial nerve, olfactory nerves. Interesting. See how it says right there? Olfactory nerve 1. Nope. This is optic nerve 2. A little problem with 13.22, Pearson Publishing. Number 3, oculomotor. Oculo means eye, motor means movement. So this is the movement of the eye. The trochlear nerve. This is about primarily motor, some to the extrinsic eye muscles, again, moving the eye around. The trigeminal nerves, there are different types of divisions, right, for the ophthalmic, the eye, the maxillary, mandibular, right eye, maxillary, mandibular. This is where we're going to the cranial nerve 5, the trigeminal, right? If you're going to have any kind of dental work, right, this is what they're trying to numb the maxillary and mandibular divisions of each of your trigeminal nerves, depending on if you're having a tooth drilled or something like that. Cranial nerve 5, again with the trigeminal, right? You can see the regions of the head and neck that are supported by it. The trochlear nerves, right? Primarily motor. Number 7, the facial nerves, mixed nerves, all different types of chief motor nerves of the face. So any of the movement of the face, cheeks, things like that. Facial nerves, vestibular, cochlear, that's going to be about balance, mostly sensory, equilibrium. Hypoglossal, right, it's mostly going to be tongue movement and things like that, chewing, etc. The vagus nerve, you'll notice how it extends from the throat, where it does have some control over swallowing, all the way down to the heart, the lungs, the digestive system, right? Somatic information from the viscera. We're going to let you know breathing rate, heart rate, digestive system, things like that. So that's one. Number 10 is really complex. Number 11 is the accessory nerves. Oops, excuse me. The accessory nerves. Some people don't think they should be cranial nerves because they're really part of the rootlets of the spinal cord, but they get bunched in there. Mixed, trapezius, sternocleidomastoid muscles, kind of the neck. And then we end up with the hypoglossal nerve, which is the tongue, again, more tongue movement. Then we proceed down the spinal nerves. We have 31 pairs of nerves. There are basically one pair for each vertebrae, with the exception of the cervical, because one is above C1. So there are 8 pairs of cervical nerves, even though there are only 7 cervical vertebrae. All right, they're going to supply the body, right, basically from where they originate. 7 cervical vertebrae give rise to 8 cervical nerves. And if we look at the different plexes here, the cervical nerves, C1 through C8 form a cervical plexus. Then we have the brachial plexus, thoracic. Then we have the lumbar plexus, the sacral plexus. Notice how lumbar nerves, just 1 through 5. And then sacral and coccygeal nerves. And again, they are going to innervate the various regions sort of as they proceed down the spinal cord. So each spinal nerve is connected to a spinal cord via 2 roots. The dorsal root contains sensory, and the ventral root contains motor. So when we look at this picture, right, you see the bodies of the vertebrae in the front. You see the spinal cord and those yellow sort of fingerlings, right? One going into the dorsal side, one going into the ventral side. And the ventral root is right, ventral side, the anterior. And so the ventral root is going to contain the motor neurons. So anything that's going to go out, away from the spinal cord, away from the brain. On the back, we have the dorsal root, right? Dorsal meaning sort of the posterior side. So that's going to be the sensory information. So it goes from my fingertips up the nerves, up the brachial plexus, in through the dorsal root, up to the thalamus, etc. We decide to do something, down, same passageway, out, and then some sort of contraction. All right, so this is the roots, ventral and dorsal. Then we have something called the dorsal and ventral rami. Now, a rami happens after the ganglia, and it innervates sensory and motor to the regions of the body. So the dorsal ramus is going to contain sensory and motor nerves for the dorsal region of the body. The ventral ramus is going to contain sensory and motor nerves for the ventral ramus of the body. So it's going to go from my finger up through the brachial plexus, in through, since in anatomical position this is the front, in through the ventral ramus to the dorsal root ganglia, then split and go to the dorsal root up to the brain, from the brain down, out the ventral root, and if, let's just say I'm contracting my triceps, that's the posterior part of my arm, ventral root, and then to the dorsal root ganglia, and then to the dorsal ramus, because that's going to be on the back. So there's all kinds of different connections, right, between how things get where they get. But dorsal and ventral rami is anterior and posterior body. Dorsal and ventral roots are sensory versus motor. Woo! Most spinal nerves are really short, right? There's, again, the dorsal and ventral ramus, the meningeal branch. And again, the rami also contain the autonomic nerve fibers. All right. Now, the difference between roots and rami. Roots lie medial and form spinal nerves. Each root is purely sensory or motor. Rami lie distal to and are lateral. They can carry both sensory and motor information. All ventral rami, except for the thoracic, form a network called a plexus: cervical, brachial, lumbar, and sacral. Each one of these plexes are a really complicated interwoven network of the nerves, the spinal nerves in that area. So if you look at, let's look at the phrenic nerve. You can see that one going all the way down. If you follow the phrenic nerve back up, it has nerve roots from C5, C4, C3, maybe even C2 and C1, all in that phrenic nerve. So it's innervating the skin of the neck, ear, back of head, neck muscles, but they're all interconnected. The phrenic nerve, diaphragm, breathing muscles, and the phrenic nerve receives fibers from C3 to C5. All right, so there's all kinds of, when you're talking about a plexus, right, look at this one. We have the cords that go down to the radial, the median, and the ulnar nerves, but look at all of the different mixes of the roots from C4 to T1 for the brachial plexus. All right, so the cervical plexus, this is what the branch is. This is where the rami come from, and this is the regions that are served by each of the branches. All right, same thing here. Take a look at the brachial plexus and notice all these different arrows. You can follow C6 to the upper trunk, to either anterior or posterior, anterior to lateral, lateral to median, right? You can see all, that's why it's called a plexus. It's a very complicated, interconnected network of nerves. And why would that be, right? From an evolutionary standpoint, or just from a physical standpoint, say something happens to your C6 nerve. If we were to block out C6, right, everything on the left-hand side of the flow chart can still happen, because C5 might be able to kick in there. C7, if we block out C7, we might end up with a malfunctioning middle trunk. However, aren't there other trunks, the upper and the lower, that contribute to the posterior, the medial, and the lateral? Right? So it's sort of a check and balance system. If one of the nerves are not really working, maybe another nerve in that plexus could take over. All right, here's the lumbar plexus. It's L1 to L4, and again, you'll see the sort of convoluted mixing of these different plexes, what they do. And then this is the sacral plexus, L4 to S4. The sciatic nerve is the longest and thickest nerve of the body, right? But again, you'll see how it's a mix of different nerves from these various spinal nerves. All right, this is a really, really vague summary. The cervical plexus is C1 to C4, some C5, brachial C5 to T1, lumbar L1 to L4, and then L4 to S4 is the sacral, the major nerve that originates from there. All right, part 3, the motor endings. The motor endings are going to innervate skeletal muscle, visceral muscle, and glands. And how do we do this? We're going back to the neuromuscular junction, right? The skeletal muscle, we've done this already. The action potential travels down the neuron, etc., etc. Movement of sodium and potassium across the membrane. We don't need to go over this again, but that's how. We finally got to the axon terminal. We kind of know how we can get from here to there now. Again, the neuromuscular junction shouldn't be foreign. Should be something you just need to take a look at real quick. Now, visceral muscle and gland, it is innervated a little differently through what are called varicosities. Not so much a motor end plate, but each one of those varicosities is going to touch the junction of that smooth muscle cell. It also uses acetylcholine and norepinephrine, and they're going to act indirectly via secondary messenger. So acetylcholine will tell something to do something, just a secondary messenger. A little bit of a slower response, right? Because we're talking about slow peristaltic contractions. No need for any kind of fast somatic response. Lastly, we have the reflex. Now, reflexes are a rapid, voluntary, predictable motor response to a stimulus that doesn't usually involve any sort of integration from the central nervous system. There are certain types. You can be born with them, the intrinsic kind, or you can learn them, right? Most of us are able to sit up straight without thinking about it, right? Because our brain knows how to interpret our body in space, and we don't have to think about it. Our brain doesn't even think about it. Unless we go to tip over, then all of a sudden we know. So it's an inborn intrinsic reflex. Things like poking you in the eye, if you touch something hot, any of those things that your body intrinsically knows. An acquired reflex is something that you do over and over and over again. Reading, writing, driving, playing the piano, playing a sport. Something that becomes reflexive because you've learned it. The reflex arc contains sort of 5 stages. We have the receptor, which is the site of the stimulus. We have the sensory neuron that's going to take the impulse to the central nervous system, usually the spinal cord. We're going to have a small integration, right, which is just going to connect that sensory to that motor output. And then we are going to have a motor neuron to the effector, and the effector organ or gland responds in kind. So again, receptor, sensory neuron, integration center, motor neuron, and effector organ. Spinal reflexes occur without direct involvement of the brain. There are different types of stretch and tendon reflexes, right? This is the initial stimulus here is muscle stretch, right? That's going to go in and go out. And the stretch muscle will then contract. So it's a stretch muscle reflex to inhibit its antagonist. So if I go like this, if I want to contract my bicep, I want my tricep to relax, right? Otherwise, I won't be able to contract my arm. So we want to, that's kind of how that works. The tendon reflex, right? If you've been to the doctor and they give you that little tap on your knee and up your leg goes, right? That you're hitting that patellar tendon. It sends the information to the interneurons of the spinal cord and back out, and boom, the quads contract. The flexor and crossed extensor reflexes, right? The flexor withdrawal, right? If you touch something hot, you pull it away. The withdrawal reflex. That's pretty much any part of the body. The crossed extensor reflex is when you reflex the weight-bearing limbs to maintain balance. So when you step on one, right, this side of the body, and then you step on the other, right? Stepping on broken glass causes the damaged legs to pull up and the withdrawn legs to extend. If someone grabs your arm, your other arm goes like this, the crossed extensor reflex. So there's all different types of reflexes. All right, so that's the end of chapter 13, the peripheral nervous system. We have the sensory nerves that go towards the integration of some sort, the motor nerves that come out. You should be able to, at this point, trace the path of some sort of touch receptor up the specific nerves to the rami, to the roots, to the integration, to the somatic sensory, and back out, right, to the muscle, to the acetylcholine, and then to the contraction through relaxation. That would be a pretty good, essay question if I do say so myself. So we're almost done with Anatomy and Physiology 1. You just have chapter 14 to look for, and I